Hello, everyone. My name is Dr. Yonit Arthur. I'm an audiologist and coach. You're on the Steady Coach. And I'm coming to you today with a long overdue video. This is going to be part of the Ask Dr. Yo series of videos. So these are unedited videos in which I answer your questions. You can find an entire playlist of the Ask Dr. Yo videos linked in the description below. And this particular one is tricky, and I'm going to explain in a minute why. But first, let me tell you what it's about. We're going to be talking today about superior canal dehiscence syndrome, or third window syndrome, also known as SCDS. You may see it abbreviated that way. Now, before we get into what this actually is and all the things I want you to know about it later in this video, I want to explain why this video was so tricky, because it's going to set up the context for what I'm going to say in another couple minutes. By far, the most common cause of chronic persistent dizziness symptoms is vestibular migraine and PPPD, both of which you've heard me talk about extensively on my channel. Maybe if this is your first video, welcome, but many of you have heard videos of mine before. Those are neural circuit symptoms, or neural circuit diagnoses, I should say, that respond very, very well to all of the techniques and methods that I talk about on my channel. So the issue is that with vestibular migraine and PPPD, there is a very, very strong overlap with anxiety, and particularly health anxiety and obsessive compulsive disorder. Even for those of you who never had anxiety or obsessive compulsive tendencies before, the symptoms themselves can cause you to enter into a cycle of anxiety, which again, I've talked about previously. As a result, when I put out a video like this, knowing that many of you are dealing with tons of health anxiety, it makes me pause, because there are an infinite number of things that the health anxiety can attach to. And one of the things that I've asked you to do as part of your recovery is to stop looking up scary things that can be wrong with you on the internet. And this video sort of falls into the category of scary things that can be wrong with you. So I have a few suggestions. If you've already been diagnosed with a neural circuit dizziness issue, such as vestibular migraine, PPPD, or MDDS, and you were diagnosed by someone who specializes in vestibular disorders, and you've been thoroughly medically cleared, and that's the diagnosis you have, you may just not want to watch this video. You may want to click out of it. Now, there are others of you, though, that may not have a clear diagnosis yet, and this video might actually be important for you to hear at some point. But if you're dealing with a ton of health anxiety, and you're dealing with a lot of fear, maybe you're new to my channel, or maybe you're not new to my channel, you're just really, really struggling with that anxiety stuff, this is probably not a helpful video for you to watch right now. The information that I'm going to give in this video is, I think, important, but it's not urgent, meaning it's something you probably do want to know if you have not been thoroughly assessed by a neurotologist or another specialist in dizziness. But it's not urgent that you know about this right now. If you're dealing with high levels of anxiety and fear, that is your number one priority, learning how to work with those things. So my suggestion is, if you're dealing with a lot of health anxiety, obsessive compulsive disorder, and or you have a clear neural circuit dizziness diagnosis, you go ahead and stop this video right here. In the video description, if you click more, right below this video, click more, I will have alternative videos. If you want to watch a video, I have other videos that I think will be more beneficial to you. You are welcome to bookmark this video and come back to it. But again, you want to have tools for working with your health anxiety first before you allow it to latch on to a video like this one. There's my long preamble. I know that was long. And for those of you who are, again, brand new to my channel, you might be like, why did she just spend several minutes talking about anxiety? Yes, it is very important. Okay. So the other thing is, the other reason that this is a tricky video. So some people with superior canal dehiscence, or third window issues, I'm going to explain again what these are in just a moment. Some of you out there with that particular diagnosis, need surgical treatment. You need medical management and surgical treatment, and that's it. And it's not a neural circuit problem. And so the methods on my channel aren't totally applicable to you. For many of you, my experience is that you have kind of a hybrid condition. In other words, that the symptoms you're having may have started with dehiscence or third window syndrome. The diagnosis is accurate, but not all of your symptoms are the result of the actual dehiscence or third window issue, again, which I will explain shortly. And then still a third category of you, I think some of you were misdiagnosed and do not have a superior canal dehiscence issue or third window syndrome. And your symptoms are simply being blamed on that issue, but you have a neural circuit dizziness problem. Okay, so now in the video, I'm going to do my best to explain how you might figure out which category you fall into if you do have this diagnosis or could potentially get this diagnosis. Okay, so first of all, let's differentiate between what superior canal dehiscence and having a third window are. Let's differentiate those from the actual syndrome. This is super important, okay? So to understand this, you need to understand that the inner ear is a pressure detection system. Think of it like a tire that's full of air, right? So basically sound comes in, pressure changes come in when you move or when you strain, and those pressure changes let your ear know what's going on. Imagine then if you have a hole somewhere in that system. Your pressure detection system wouldn't work so well, right? Imagine if you were trying to measure the pressure in a tire using a pressure tire gauge, and there was a hole in the gauge, and it was just leaking pressure. You would not get an accurate read, right? So that's essentially what superior canal dehiscence and third window refer to. It means that there's some hole in the tissues and or bone surrounding some part of the inner ear. Superior canal dehiscence means that particular hole or opening or thinning of bone is over the superior canal, which is part of the vestibular system in the inner ear. And third window syndrome is a more general term that means that that hole is somewhere in the system. It's not necessarily on the superior canal. So I'm going to use the term third window syndrome from here on out in the video because that includes SCDS or superior canal dehiscence syndrome. But I want you to know that it's essentially the same thing. If you were diagnosed with SCDS, third window syndrome is what you have. Okay, so the thing here is that many people actually have dehiscences or third windows. Many people have little abnormalities in their bone or tissues around the inner ear that don't and never cause problems. In fact, it depends on who you listen to, but somewhere between 1 to 5% probably of people in the general population have some kind of third window, okay? And as you guys know, not 1 to 5% of the general population has chronic dizziness, which means that for many people, this particular issue, this third window, this opening in the bone of your inner ear, is actually a normal abnormality. It's not causing problems. It's something you were born with, or maybe your bone thinned later on in life, and it's not going to ever cause problems. This is why even the most strong experts or the strongest experts on third window syndrome say that you should never have it diagnosed just based on a CT scan, because they could potentially find this opening in the bone surrounding your inner ear and not have it cause any symptoms at all, or not be the cause of any of the problems that you're having. So to get a proper diagnosis, there are further steps, and we'll get to that in just a moment. But I want to differentiate this now, this third window existence that apparently affects a lot of people, from third window syndrome. Third window syndrome means that you have this opening in your inner ear somewhere, or in the tissues and bones surrounding the inner ear, but you have symptoms, meaning there is actually pressure leaking out of your inner ear. And as you can imagine, again, the inner ear involves hearing and balance. So frequently this causes hearing and balance issues. Now, I'm not going to say that it can't get a little tricky to tell if the symptoms are consistent with a third window issue or not, but there are usually some telltale signs as well as some diagnostic testing that can really pin down whether you have third window syndrome or just a third window that's not causing any issues. Okay, so third window syndrome means you're having particular symptoms, and those symptoms typically include something called autophony, which is when your own voice and body sounds are unusually loud and or distorted. So you'll hear your own voice as too loud or distorted. You may hear your eyes blinking. You might hear your neck creaking way louder than normal. Those types of sound are louder and distorted for many people. Also, people tend to have their symptoms, this sensitivity to loud sound and or dizziness, brought on by surprise pressure changes and or loud sounds. Okay, so remember, we talked about how the inner ear is a pressure detection system. Sound is just pressure changes. So when there's loud sound and or when someone's straining really hard or lifting something heavy, that causes a pressure change in the inner ear. And if you have a big opening in the inner ear, sound pressure or just physical pressure are going to leak out and make your brain think that you're moving when you're not, and or make the sounds feel very uncomfortable. Okay, so sneezing, coughing, lifting heavy things, these are usually the telltale signs that someone might have third window syndrome, because those are the types of things that cause hearing and balance related symptoms. Now, that's not to say that everyone who has third window syndrome has those symptoms, but when I see in the comments someone says, it's really weird, I get dizzy or I get vertigo only when I cough or when I strain, that's what makes me think, gosh, that person really should see a neuro-otologist to make sure that we don't have third window syndrome. Which brings me to, how do they know? How do we know if you have third window syndrome? Well, we do need to look at your symptoms, but there are also some clinical exams that a trained doctor can do in office that can help tell us if you actually have pressure leakage from the inner ear or not. There are specialized CT scans that can tell if there, again, is an opening in the inner ear. But as I said earlier, that is not a diagnostic of third window syndrome. Many people have those openings with no symptoms, but often this is included in the test battery. And then there's a test called vestibular evoked myogenic potential, VEMPS. And that particular test can also tell if there's a sign of pressure leakage from the inner ear. So most people who specialize in vestibular disorders, this is something they rule out quickly. This stuff should be done, maybe not the CT scan, but they should be looking for signs that you might have a pressure leakage. And they should be doing VEMP testing really, as far as I'm concerned, on day one of your assessment. And if those tests come back normal, then they're not going to send you for a CT scan because you don't have symptoms that are consistent with third window syndrome. Okay, so now, what is the treatment? So if you actually have third window syndrome and all of these things that I just described point to that being the problem, then physicians will typically recommend surgery, because basically if it's a pressure leakage problem, we plug up or stop the pressure leakage and things go back to normal. That sounds very cut and dry. The issue is that I have encountered, first of all, some individuals who just don't want to have surgery. It's pretty intensive surgery, and they've asked me, hey, can your method still help me? The second reason this is somewhat problematic, as far as I'm concerned, is that not all clinicians are following the guidelines in terms of diagnosing based on all the criteria I just mentioned. Dr. John Carey at Johns Hopkins University, who is a specialist, an expert on this, he says that this third window syndrome is actually overdiagnosed in some cases, and people are sent for surgery unnecessarily because they're being diagnosed just based on a CT scan, for example, when that's not appropriate, because just because someone has this pressure, this appearance of a hole in the inner ear, again, 1 to 5% of the population has that, and most don't have symptoms. So we can't diagnose just based on that. In addition, I have seen people who definitely had third window syndrome, did the surgery, were basically the pressure leakage issue is completely resolved, and they still have symptoms. Why? Because even though the symptoms started from the third window issue, they ended up with neural circuit dizziness symptoms. Like many of the other people on my channel whose symptoms did start from a physical cause, like vestibular neuritis or BPPV, symptoms can become persistent for reasons that are different from why they started. What started your symptoms is not always what makes them become chronic. And I have seen this enough times in my work to be able to make some suggestions for you. First of all, the main suggestion I have, of course, is see a vestibular specialist, ideally a neuro-otologist. Someone who specializes in vestibular disorders is going to rule out third window syndrome right away. That is something they should be doing on, again, as far as I'm concerned, on day one of an assessment. The second suggestion I have for you is you should know that you are not just an ear. I know, revolutionary. You are not just an ear. Something that affects your inner ear for sure can cause symptoms. But you have a whole brain that handles stuff, and you have a whole body that cooperates with your brain. So just because your ear is sending faulty information to your brain at times, that does not necessarily explain all your symptoms. Now, again, because the balance system is complicated and uses many senses to help you balance, there, of course, some people will end up with multiple symptoms that don't necessarily directly relate to the inner ear, because your eyes, ears, and sense of touch all contribute to balance. So if you're having an issue with your inner ear, it can cause visual stuff, for example, and that can happen even with third window syndrome. However, your brain can also start to wildly misinterpret all sorts of other sensory data, especially if it gets stuck in a cycle of fear, anxiety, stress, and all the other things that I talk about here. Basically, I sum them up by calling it threat mode, danger mode. I would encourage you to watch my other videos if you don't know what I'm talking about. So here's my plea to all of you. This is what I'm really trying to get to. Even if you have clear confirmed third window syndrome, you should still be incorporating a lot of the techniques that I talk about on my channel with some modifications. You can absolutely take the free course. Anything that you can do to bring down your fear and anxiety is going to help your brain adapt quickly. So let's just say you have a weird pressure problem in your inner ear right now. Maybe you're going to get surgery, maybe you aren't. You want your brain to be able to quickly adapt to those kinds of changes without getting totally freaked out and starting to predict problems everywhere. So learning how to work with sensations, calm your body, deal with anxiety and fear, deal with stressors in your life. These are universally helpful skills, even if there's a physical problem that you are or are not going to get taken care of surgically. And I think, again, that will help. Now, with the modifications, if you are going to have the surgery and the surgery is successful, or you've had it and it's been successful, then my expectation for you is that you can fully recover from any residual symptoms. The residual symptoms are a neural circuit problem. If they've dealt with the pressure issue in your ear and it's done and you still have symptoms today, then you have neural circuit dizziness as far as I'm concerned, and you should be using all the stuff on my channel. And for you, you can, when I say things like, there's nothing physically wrong with you, there's no tissue damage, that applies to you because your ear's working the way that it should now, okay? Even if you've lost some function due to the surgery, you are similar to other people on my channel who have loss in one ear or both ears because of neuritis or what have you. That does not mean that you can't fully recover from the symptoms. For those of you who are not doing surgery or have not yet done surgery, you're going to have to read through my course understanding that I'm going to be talking about not having tissue damage or problems in the inner ear. And you're going to kind of note to yourself, yes, right now I have a pressure management problem that's causing some symptoms, but my nervous system is also responding to interpreting those symptoms and making them bigger. And I can do a lot about that. Okay. That was a lot. I really hope that those of you with health anxiety took my advice and are not here at the end of this video. But if you are, again, the best solution for anxiety that you've come up with thus far in the video is to just make sure you have medical clearance. And if you've been diagnosed with vestibular migraine or PPPD or MDDS, then you don't have third window syndrome. Again, assuming your doctor has done his or her due diligence. This is not applicable to you, but the principles that I talked about today are definitely applicable to those of you who do have third window syndrome or SCDS. All right. Well, that was long. I hope I did justice to this topic. Questions and comments, please drop them below. I'm happy to make more content on this topic if you're interested. The vast majority of you watching my channel, this does not apply to you. So again, thanks for tuning in. Questions and comments, you can put them below. As I said, like, share, subscribe to my channel, and I will talk to you all soon. Take care.